Do you have a friend who wants to know how to relieve testicular pain? My name is Garcia Cruz, I'm a urologist, and for 15 years plus I've been working with men with urology issues such as testicular pain. And I would say that my very first advice for men with testicular pain is tight underwear. Tight underwear, as easy as it might seem, is the very simple advice we give to most of the gentlemen who come to the office with testicular pain. And I would strongly advise you to use the tight underwear, especially if you're going to, for example, work out, or you're going to have a hard day, you're walking around, etc. It's something that it really works. The second thing would be trying to avoid some kind of exercise, like for example basketball or volleyball, all these sports or activities in which you jump a lot, because that would increase testicular pain. And the third thing, which is common sense, would be to use some painkillers such as acetaminophen, which is a very common painkiller for many things. My advice would be to use tight underwear and use one painkiller every 8 hours. And my second advice would be to use painkillers. Like most painkillers are useful to relieve testicular pain. You can use, for example, ibuprofen, you can use acetaminophen. They both work. Many of the common painkillers are useful for this situation. So I would advise you to do a trial every 8 hours for a week. That just works. And the third thing would be to apply cold, but indirect cold, like for example with a glass of ice, but through a towel. That's something that is very useful to diminish inflammation and to diminish pain. And that's something I would advise, for example, if you arrive home after a long day and you're having testicular pain, these ice, but indirectly through a towel, that's something that works really nicely. So my three advices would be tight underwear, second would be painkillers, and the third would be indirect ice application. I hope this video was useful. So if it was useful to you, just give us a like and subscribe to the channel. You know that I have a friend who channel we have tons of videos about urology and men's health. Bye bye.